Hello, everybody, and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And we have a great guest today. So I'm excited that for over 3 decades, Dr. Robert L. Kane has been at the forefront of clinical thermography for the integrative medical doctor and holistic practitioner, leveraging advanced infrared imaging to detect signs of inflammation, nerve injury, impaired circulation, and psychological stress, often before symptoms manifest. He's recognized as one of the North America's leading interpreters, supporting over 50 thermography centers worldwide. Dr. Kane's mission is to empower healthcare providers with objective science-based tools to maximize health and wellness. Dr. Kane, thank you so much for being on the podcast.
Thank you. Happy to be here.
Yeah, I mean, you have a whole aspect of the industry, which is just amazing to me as I go on in my career. You know, I've got gray hair and I'm losing my hair, but I keep running into people that are doing things that I've never even heard before, including thermography. So could you tell the audience, you know, obviously dentists and people in oral health, kind of what thermography is, how physicians are using it, and where its place in dentistry could be?
Yeah. Yeah. Well, thermography, very simple, is taking pictures of heat maps of the body. So this came out of military technology. The Navy was looking for ways to spot ships over the horizon so that they could prepare for attack. And they would catch the infrared signatures using specialized technology. In the 1950s, it was declassified and came into medical application because heat is a function of circulation. And we could start to get from the circulatory signals, we can start to get information on inflammation and things like that. So really, it's just you stand in front of a camera. There's a picture right behind me right here that kind of gives you an example of it. It puts together a color picture that shows heat zones that can be analyzed. Now, for the dental section, I think it's particularly interesting because infection is one of the things we start to see. And many people are running around with low-grade dental infections. They may not even be symptomatic in the normal way of tooth pain, yet we see signs of those thermal signals, we see signs of that infection, and we can help target that area that needs to be evaluated more closely.
It's really interesting. You know, I've been doing a lot of research on this now. In fact, my latest book, Untitled Chapter, has a lot of sections about how oral health affects overall health, right? And, I mean, what you just said, you know, a lot of this comes down to, as dentists and, you know, physicians too also recognize, there's a growing evidence that oral disease affects overall health. And, you know, from studies that are showing the bacteria that cause periodontal disease in the brains of Alzheimer's patients, all sorts of crazy connections that, frankly, even a year ago, I was like, would have shocked me that these are happening. But a lot of it comes down to, because, you know, periodontal disease is a big factor here, but it's chronic inflammation, right? And I would assume that what you're saying too is that this chronic inflammation would also be evident in thermography-based imaging. Is that correct?
Yeah, inflammation is going to cause increased blood flow to an area, and that's going to carry heat with it. So the inflammatory signals will show increased heat. Low-grade infection will show increased heat, and we can start to target where are they occurring, and could they be related to a particular tooth or periodontal area, or just something in the oral sections that need to be evaluated more closely.
Are you aware of thermography being leveraged in dentistry at all right now? I mean, like in the oral cavity, because I mean, I work with a lot of technology companies. I've never heard of thermography being leveraged, basically.
Yeah, I'd say right now inside the oral cavity, it's more experimental. There's a lot of research being done about how they can deal with the fact that a cavity will trap heat. So it's like a fog around your vision. It's a little harder to see, but there's ways they're working on to do that. But traditional thermography actually looks at the outside of the mouth. Because again, we're looking at not the infection itself or the inflammation itself. We're looking at its effect on the blood supply. And that's going to go further than just the local site. So a wisdom tooth infection or a wisdom teeth inflammation is going to start to show heat coming into the jaw here. And, you know, this other side here. And if it's infection, we're going to start to see accompanying lymph nodes get warm, showing that infectious pathway coming down.
Is that true of pulpal infections too? So people that have, I don't know, let's say a abscess tooth or even an inflamed tooth, like irreversible pulpitis, things like that.
Yeah, absolutely.
That's interesting. So, potentially you could use or extra oral imaging to diagnose intraoral pathology, correct?
Yeah, it's not that it'll make the diagnosis, but it'll lead you to it.
Yeah.
So, I'll give you an example. My wisdom teeth were impacted. So I had no symptoms other than, oh, they say they're impacted. And I thought, "Oh, why am I bothering getting them out? I just don't want to bother with this stuff. But I'm in thermal imaging. So regularly I get image and I get an image of my face and I'm noticing my sinuses are all congested on the images. I can see inflammatory patterns here and I'm starting to
Mm.
notice heat build up here and here. Well, I didn't think about it for a while until I noticed I was getting more sinus infections. So finally, I go ahead and I get the wisdom teeth out unrelated. Interestingly enough, not only did the sinus infections resolve, but all those thermal findings that we were picking up went away. So the thermal findings showed me that there was an irritation, whether it was inflammation or infection going on in that area before symptoms were really present. And if I had known what I know now, I would have taken those signs and said, get them out. It's time.
So I'm going to ask you the same question that every dentist is thinking right now.
Yeah.
Had the dentist recommended you had the wisdom teeth taken out previously, or they were just kind of watching them?
No, no. They recommended they come out based upon the theoretical impact of having dental problems.
Mhm.
Now, every dentist is a little bit different in terms of how they explained that. For me, it all I heard was an inconvenience. All I heard was that it potentially could affect the bite. I wasn't seeing any of those things, so I decided to monitor it. But at the same time, it's if I had seen those thermal findings in the beginning and understood the implications of them, that would have been a huge impact in making my decision.
Yeah, and I mean, I think the theory that it would affect your bite, I think, has been debunked. That's
Mhm.
let me know if dentists disagree with me. I'd love to have that conversation.
Yeah, and
But
this was years ago when my wisdom teeth
yeah,
came out, so it's an old
yeah.
story. I'm here, giving you older information on it.
Well, I just want to dispel the myth for the dentist listening, right? But the what I would have said, I believe, if you were asymptomatic, and is that they could become problematic. Let's say if you have an acute issue when you're in your 90s and on a bunch of medications, like
Mhm.
when you're don't want to have that happen. So whenever it's convenient, have it taken care of.
Mhm.
However, with thermal imaging, it sounds like there's actually an issue that your body's responding to, which if we have a chronic low grade infection, every dentist has restored a patient's mouth that says after restoration, I didn't realize how much pain I was in until after we restore them.
Yeah.
Right. And so relying on symptoms is probably a poor way of judging some of these cases. It's a great example with an adult with still has third molars retained that they've lived their entire life with these things and they don't even know if they're causing inflammation or not. What a great example.
Yeah, and
Uh,
they don't realize it. I mean, some of these symptoms aren't necessarily tooth pain. For me, it was more constitutional symptoms and sinus stuff. I didn't make the connection, but the thermal imaging was pretty clear there was a connection because there was heat by the teeth and there was heat by the sinuses and and activation of the lymphatic pathways. So, like I said, if I understood what I was looking at, I would have turned around to my dentist and said, "Get them out now. It's affecting my health."
well, you got my gears turning, Dr. Kane. I feel like, you know, I'm doing a lot with medical dental integration right now, both from a
Yeah.
systems perspective, but then also how to, and what I'm wondering right now, and I'd love to hear your opinion about this, as we talk about as the dialogue, particularly in dentistry, but also in medicine. I was just at the health conference, and we had an oral health pavilion with that CareQuest and some other companies put on, and then I'm on a panel at HIMSS, so I'm more and more talking to coming up in March, more and more talking with physicians. And the more I talk with physicians, they actually recognize the importance of oral health and overall health. And I'm just wondering, and this is a completely unfair question for me to ask you, but I'm going to ask it anyway. Do you have an idea of, as we look at this oral oral health, overall health connection. What percentage do you think of these oral based systemic issues would we actually be able to capture through thermography? It's a
Yeah,
completely unfair question,
no, it,
but I'm just wondering because I think that's that I think I could see that that would make a case in oral health.
yeah, it's the $1 million question, right? Because if we had percentages, then we can really move this into the mainstream and standardize this as part of what's done standard of care. Um, it's I can only guess because nobody's looked at those percentages, but I'd say from what I've been seeing, I'd say somewhere 70, 80% of the time when we see thermal signals, the dentist will go in there and find actual pathology or some sort of functional problem to address. And a large percentage of those too, again, 70, 80% of those will get some sort of symptomatic relief, whether it's in the oral cavity or with other systemic cases.
That's interesting. Well, I don't know what the percentage is, but on the percentage of people with who have had thermography and had has led to an oral overall connection, it's 100% on this podcast.
Yeah, we've got I've got certain centers that I represent, and we do a lot of breast imaging for them. And several of them have actually moved to do breast imaging and facial imaging, and they were going after a connection between oral oral concerns and possible breast cancer. And we do know that the lymphatic pathways run down, and it's possible that if the lymphatics are activated from the neck, it's going to start affecting the chest wall. And we also know that certain thermal findings in the chest wall and in the breast tissue have a higher risk, not just for having breast cancer, but for developing it in the future. So they're looking at it from a wellness perspective. Can they identify facial problems that are not just affecting the face, but are affecting the breast? And can resolving those facial problems normalize the breast tissue and effectively lower risk for breast cancer in the future?
Wow, that's really interesting. I have a personal story with breast cancer over the last couple of years where I just you can connect the dots in reverse, but the lack of it's led to me thinking about how people wear ribbons for breast cancer awareness and stuff. And frankly, I think we're barking up the wrong tree. The people that have to have breast cancer awareness are physicians, frankly,
Yeah.
right? And so I think what you're talking about is the lack of diagnoses for overall health is very problematic for people. And the big thing that I think that the mission that we're pushing for is to have clinicians and patients take back care from forces that are not really cared about that just don't care about wellness. Huge. And this seems, now correct me if I'm wrong, but thermographic imaging seems like it's a very low cost way to do screenings to catch these potentially uh you know catastrophic issues earlier that then lead to better outcomes and lower cost treatment. But I'm thinking of thermography can't be an expensive type of imaging.
So, I mean, it's a couple $100 for a region. It's not that expensive. It's not an MRI. It's not $1,200 a test. We're
Yeah.
talking about $200 to $400 depending on what's being imaged. And what's nice about the thermography is that rather than trying to diagnose a disease, you're looking for functional imbalance. And functional imbalance is the predecessor to disease. So if we can start identifying functional balances and correct those, we have the best chance of preventing chronic disease. And, this is, the stuff that, Peter Attia is promoting now with Medicine 3.0, the idea that we haven't made a dent in chronic disease. We need to start looking at how to prevent this stuff and what are the biomarkers that help us prevent it. Thermography provides thermal biomarkers that can be leveraged in order to develop techniques and strategies to make sure that we don't move down the pathway further towards disease outcome.
Yeah, I mean we're saying the same things from different directions, right?
Yeah.
I feel like Dr. Attia looks at it sort of from the perspective of what's the future look like. I also look at it from the perspective of basically medicine's not broken, it's rigged, right? There's reasons why it's working the way it's working. And I believe that those of us who are clinicians or patients that actually care about their wellness have to take, a little bit matters in our own hands, and doing simple, not simple, but doing incorporating broader scopes of diagnoses, particularly think with through things like thermography, make all the sense in the world. So given that, because right now I am not aware of one dentist, I'm sure there is, but one dentist that has incorporated thermography into their practice. So how would you say we in dentistry start incorporating this into our practices?
Well, I think the idea is that number one, we need to get access to equipment. And a dentist can purchase the equipment if they wanted to have it in house, or they can locate a thermographic center close to them. Once they have that, then they can start ordering scans. Now, the scans, the general scan for dentistry is a cranial it's a face and head scan. So we look at all aspects of the face, we look at the jaw, we look at the lymphatic pathways. And depending on what's going on with that patient, if they are interested in other systemic conditions, they can start to look at the upper body or the lower body. But I'd say the face is probably the biggest place where you're going to get the bang for the buck, because that's where you're going to get the data. Is there functional imbalance that might not be detected otherwise? And also something to show to the patient to let them know, hey, we really did find something. This is not just theoretical here. There's actually something going on, and we're seeing it here. Maybe we see it on your X-ray. This is something we should take care of because it's affecting other areas.
Well, Dr. Kane, I've been doing this podcast for probably 7 years, and I've done hundreds of podcasts, and I can't think of a topic that I knew less about going into the podcast, and I want to know more about leaving the podcast. So I'm excited to have more conversations with you offline, and for everybody else hopefully there's other people listening that think the same way. Where can they go to get more information?
So my website is Kane, Kane, thermalimaging.com. And if you go to my website, it's got my contact information. It's got some basic information about what I do. It's not really geared towards dental, but that's coming on the website. But certainly they can drop me an email. They can contact me that way. And I'm more than happy to talk to them about what it takes to start incorporating this kind of technology into their practice.
Great. So go to KaneThermoimaging.com.
Right.
Kane, because I certainly will.
Yeah.
Yeah. Well, Dr. Kane, thanks so much for being on the podcast.
I appreciate you having me. Thank you very much.